Everybody, it's Barb and Christy here today. We're going to give you some information about the ADA standard of care and the latest information on fluorides and concentrations and what we should be doing and how we should be using them. So Christy, there are 4 concentrations of fluorides.
Really?
There's 1 part per million, there's 1,000 parts per million, there's 5,000 parts per million, and there's 22,600 parts per million.
Wow.
So if I may, I'm going to take you way back to school.
Okay.
1 part per million is found where?
That would be in water.
Ah, very good. Lots of people don't know that. So for all of you that didn't know that, now you know 1 part per million is in the water. And 1 part per million is designed to help which population of people?
That's for children's developing teeth. So it would be for unborn babies and toddlers.
Yep.
Because it's going from the inside out.
Yep. Smart girl. Might want to call her. Yes, 1 part per million is for developing teeth only. And the reason why I stop at this point when I'm giving this presentation to people like you out there is a lot of team members feel that 1 part per million is for the entire population. Very untrue. Once teeth erupt, they sit in an acid bath called the mouth. And if we were to depend on water, we wouldn't have teeth, because the acids combined with the great foods that we eat, and the better flavor the food, the lower the pH it will leave our mouth. So we depend on 1,000 parts per million. So Christy, do you know where we find 1,000 parts per million?
I'm not sure.
Toothpaste, believe it or not.
Oh.
So I want everybody out there listening to think about Walmart, Walgreens, CVS, Target, and the toothpaste aisle. And how many times do you walk down the toothpaste aisle and people are just staring like, what kind should I buy?
There's so many.
There are so many, and there's so many flavors and tubes and sizes and shapes. Please know that if a toothpaste product is on the market, it is between 970 parts per million and 1,100, they call it 1,000, or it is fluoride free. There is no variance in the toothpaste.
Okay.
So if you flip a box over, and I hope you do the next time you're at the store, flip a box of toothpaste over and you'll find one of 2 active ingredients. It'll be a fluoride or potassium nitrate. You'll see an active ingredient list and an inactive list. The active list is a list that has the ability to change something to your betterment. So how can 1,000 parts per million in toothpaste work? How it works is you have to brush your tooth clear of the plaque for that concentration to work. So how do people get decay? Well, they might miss right here all the time and the plaque accumulates,
Right.
and that concentration doesn't penetrate the problem. If the plaque sits, the pH lowers. If the pH lowers, we go through that whole process that we all know, demineralization.
Right.
Following demineralization is cavity. So 1,000 parts per million. I'd like to stop there and review the latest stats on decay. It's no longer cavity-prone years, as we know. It is now segmented into 4 areas. So the incidence of decay now is birth to 5 years, 28% of the population up to 5 years has experienced decay. Instead of 28%, I'd like you to think 1 in 4. If you're 6 to 11 years old, it goes up to 50%. But I'd like for you to think 1 in 2. So between 5 and 11, it's gone from 1 in 4 to 1 in 2. If you're 11 to 19 years old, the incidence of decay of that population that has experienced decay is 68%, or 3 in 4. So we go from 1 in 4, we age a little bit, we go to 1 in 2, we age a little bit more, we go to 3 in 4. This is the stat that surprised me the most. From 19 years of age through a long life, whatever that long life is, I'm going to pick a number, say 80. You have an 85% chance of decay in the oral cavity. That's
Pretty high.
high and frightening. The ADA, as of last year, said 1,000 parts per million is no longer working. So the 5,000 part per million became very popular, although it's been out for a while. There are 3 5,000 parts per million products that I know of. There may be more. ClinPro, Fluoridex, and Prudent.
Yes.
Have you heard of those?
I have. I'm familiar with those.
And have you been in an office maybe that used any of those?
Yes, both Prudent and ClinPro.
Prudent and ClinPro. Did you find a difference in any of the 2?
No, not me personally.
These 5,000 part per million products, and pause a little bit and really hear this because it's important. 5,000 part per million toothpaste is prescription only. The concentration of this product will penetrate plaque. You don't have to brush your teeth. Please do not share that with your patients. That would be really gross. If you took a 5,000 part per million and rubbed it on your finger and rubbed it in your mouth, you do not have to brush your teeth, and it will kill strep mutans, the cavity bug. If you do it twice a day, if you do it twice a day, through time, the strep mutans will be present, but they will continually die. So it's a bactericidal product. If the strep mutans continually die, you won't get decay. So
True.
the question is, would you love to never get decay?
Heck yeah.
Well, yeah, me too. A couple differences in these products. The Floridex and the Prudent both have a 30-minute window with nothing introduced in the oral cavity. So if you brush your teeth at 8 o'clock, you want your coffee at 8:10, you drink your coffee at 8:10, you've just made this product less effective.
Yeah, that's not good.
For humans, us as humans, we don't like 30-minute windows because we don't like to remember when we did anything because we want our coffee. ClinPro, the chemical makeup of ClinPro mimics saliva. And what I mean by that is if you took ClinPro under the microscope and saliva under the microscope, their chemical makeup looks the same. It's very beneficial from a clinical standpoint. ClinPro has no window. It's water friendly. From a human compatibility or human, what's the word? We're going to have them do it. They don't have the window. Anyway, if you use a ClinPro, you can use it with water. ClinPro also has 4 ingredients in it. It's a 5,000 part per million, which the other two are as well. It's got incredible substantivity. And if you remember that big word from dental hygiene school, it means, does the product have the ability to stick? And if it has the ability to stick, does it stick well and stick long? So yes, the substantivity of ClinPro is very, very good. If you brush it and spit it out, you can't get it off your teeth. That's what we want fluoride to do. If fluoride sticks to the tooth, you'll get a better effect. It's also got TCP in it, which is tricalcium phosphate. And if you go way back to school, remember the calcium phosphorus rings that held the dental tubules together in tooth formation?
I sure do.
It remineralizes that by movement of your hand. So when you're brushing your teeth, you don't have to think about it. And the other part of the 5,000 part per million, it's got 5,000 parts per million in it. So no, excuse me, it's got MI paste. It is the only product that I know of that is water-friendly MI. And MI paste is a recalcitrant and a remineralizer that you typically need a 30-minute window, not with ClinPro. So ask your coach that's there. It's a 3M product. I'm not here to promote 3M products, but ask your coach perhaps to call the 3M product for your team and see if you can get a free sample and try this product.